COVID times really tough for doctors, and today's case study is all about that. So I was talking to a doctor during my one-on-one consulting with about a month back, and this doctor had a serious issue. The issue was that she was not getting any patients at all now. you know Obviously, during corona, during covid, especially, just after lockdown, people are very very scared. People don't want to go into public places. People don't want to go to places where somebody else has been, or a lot of people have been. And obviously a clinic is such a place. Everyone would think twice, thrice, 10 times before going to a large hospital, before going to a clinic, before going to a place where 10 other people, 15 other people, 50 other people have been there previously. No matter what precautions do you take, no matter how much hygiene do you maintain, it is a concern. It's a concern. It's a genuine concern, and unfortunately you can't do a lot about it. So that was the biggest challenge that this particular doctor also had. Now what I said, that we have to solve this problem. We can't let this go forever. And I said, okay, help me understand who you are, what you do, what you have been doing, right? And this doctor was all about, okay, I have been an expert in general practice. I have been a general physician. I treat people about common ailments, common diseases, and everything. Now that is what I typically do. Now for those things, there are two issues. One of the first thing is that people are taking a lot of self medication, which is causing lot of issue. The self medication is causing so much issue that today, people argue with doctors. They are saying that, why are you giving me this medicine? I think that medicine has this side effect, and this medicine has this issue and that issue and so on. And the doctors feel like laughing about it, but unfortunately they can't do much about it. They have to convince the patient. They have to tell why this is important and why the other medicine is not important, all of that. So all that is a big nuance that's being created, big nuisance that's been created, right? The other issue is that when people don't want to come to your clinics, they uh, not only not come to your clinics, but essentially you lose out on a large part of your business. In fact, all your business. Now telemedicine is good. Telemedicine will pick up eventually. There's no way it will not pick up, right? But it has a lot of issues in terms of technology, in terms of what a human can do, in terms of how a human to human interaction is required. Think of fields like orthopedics, think of fields like occupational therapists, and all the other things where it is so important for the patient to be physically there, whether it is for a test, whether it is for touch, or anything. Now, telemedicine is not in a stage to replace all of that today, and that is again causing a lot of issue, right? So what I said was, okay, now I told her a story, and I'm going to tell the same story to you. The story was that essentially there was a person, and I personally know this person. I feel really sad about it because uh, he was my dad's best friend's son. He used to run his own clinic. I'm sorry, I'm getting a little emotional about this. I'm really sorry about it. He used to run his own factory in Kanpur. And during corona, like a lot of businessmen also, he also stepped out. He also said that I will go to the factory, I will do everything, I will do the work and all of that. He did not succumb to corona. He succumbed to heart attack, cardiac arrest. On one morning he went to the gym with his dad. He came back, both of them went to the factory, and he just collapsed in the factory. Now what happened over there? I don't know exactly. I'm not 100% sure, but I feel that he took an overdose of HCQ, which means that he used to pop in 3, 4, 5 pills every day of hydroxychloroquine, because that's self-medication. That is what is happening everywhere. People are thinking that, okay, let's take this, we'll be safe. Trump has said, or somebody else has said, let's take this, it has to work. It's on WhatsApp. Now, do you see what the main problem over here is in the society? And that is what you have to understand as a doctor, that you have to address the biggest problem in the society. So I told her that, now what I want you to do is, I want you to gather a few examples like this, where self-medication is extremely bad, where a doctor's opinion is extremely important before any treatment. And then what I want is, I want you to talk to those patients, talk to those people, and tell them that, I will be a family physician, I'll be a consulting physician, I will be available for you whenever you need me. If you have any doubt, whether it's as small as fever, whether it's as big as anything, I am available for you. You just call me, I'll tell you. You want to take a medicine, I'll tell you. You want to buy a medicine, you want to buy an equipment, you want to take some precautions, you want to do this, do that, I will tell you. Don't consult Google, call me. I am your consulting physician, and that is what you have to do. So that is what I asked her to do, and that is what changed things, because now physical presence was not required. Now it was a monthly subscription that was offered to everyone, and that helped her gain lots and lots of patients, lots and lots of credibility, and all the work can be done over phone or over a Zoom call. You don't need to step out. She doesn't need to step out. She doesn't need to, come into her clinic also. So think about it. Think about how you can innovate, and it's not just today. It is always. Thank you.